Hi everyone, this is Dr. Priyanka Mehta, gynecologist and women's health expert. In conversation with Dr. Balu, who is an emotional wellness coach and psychiatrist from UK. So we have been discussing about puberty and parents, and now we come to what should parents talk to their kids about puberty. So what is it that we need to tell our kids? Do we have a proper like a syllabus or a curriculum and just rattle off the anatomy and tell them what are the changes which happen in their body? Or do we also acknowledge the kind of behavioral changes or what happens in their mind? And for that, we ourselves need to be educated and empowered as to what does happen to a little child as they go from being a kid to an adult through the process of this teenage or this puberty time.
Absolutely. Thank you. That's a very, very important topic because this can make people feel stuck, particularly parents, because they don't know what to say. I think what to say depends on the age of the child and also the emotional maturity, how much they can take in at what stage. If the child asks a specific question in a public place because they saw something or they're responding to something that they've heard, it is important to validate that, acknowledge them, their question, and say, we will have a longer discussion about it when we get home or to a quieter place. And you can always say that this is a maturation of a person, that's a boy or a girl, and some of the changes are useful in baby making process, which leads to then the next question, how a baby is formed. That's a big, big, big question. So parents sometimes project this embarrassing questions that the children might ask, and them actually feeling an embarrassing situation and conveniently avoid it because that raises anxiety. Yeah. So, and also I've heard parents who would say they don't want to plant ideas in their child's mind. And my response to that is the child is having access to so many things anyway. So
Very true.
you're not planting anything. So that is number one. And number two, if the child has reached that age where there are secondary sexual characteristics, breast growing, testicles getting enlarged, voice changing, use appropriate terminologies to explain it to them. There is no harm in doing that. And the third, which I think I want you to comment on as well, sometimes there are problems in this process, and you don't
Mhm.
want to brush aside these problems, excessive acne, children developing emotional problems, bleeding pain, so on and so forth. Rather than minimizing that and avoiding that, I would like you to talk about what can they do, particularly around approaching professionals for help.
Yeah. So if it comes to girls, like this is the time, there is something called precocious puberty. Usually we are taking the age, the cutoff age now to be 8 years. So someone who is developing breast development, which is called telarchy, and that is followed by a growth spot or an increase in the height. And then finally they start their periods, menarche. That is how the process of puberty happens in girls. So if that process is starting, at the age of less than the age of 8 years, so by 6 years itself, breast development is seen, that could be a sign of some problem too. So, a mother or grandmother, whoever is taking care of the child and giving her a bath or helping her with a bath, can always, take help of a professional, their pediatrician or their physician or gynecologist, and that's an opportunity to take a little young girl for a gynec checkup also. Similarly, if there is no development of breast or there is no periods or menstruation starting till the age of 14 or the cutoff is even 16 years with breast development, that means there could be a problem. So, when you have problem of intersex or someone having something called primary amenorrhea where they don't start their periods at all, okay, till the age of 14 or 16 with the breast development, they do need an investigation and certain tests need to be done.
Wonderful.
Similarly, for girls, sometimes their body shape. We are seeing a lot of cases of PCOS, polycystic ovaries. So that is when sometimes it is overdiagnosed also if you do an ultrasound because that is the time when the ovaries are very immature. So they could be seeing a polycystic ovary like picture. So just going by ultrasound, you don't have to scare the little child. And also, if there is a lot of acne, whether it is boys or girls, sometimes, it hurts them.
Mm,
And very easy and affordable and accessible treatments are available for acne, where the child doesn't have to suffer. Sometimes it is just a little bit of modification of the diet. When you take the child to a skin specialist, or you're taking a child to your pediatrician and they take care of the acne, they give the medications, they give the diet advice. That sometimes goes a very long way. So parents have to, look at their child, see what is happening, right? Or if it is hirsutism, excessive hair growth, again that could lead to body image issues with the girls where they are, feeling
Yeah,
abnormal.
yeah,
So,
I
and
agree.
for boys too.
Yeah. So I think to recap, I think they are very, very important points. To recap, at any age, if the child comes up with a question which you find embarrassing, don't dismiss them, engage
Yeah.
with them, find a time, use appropriate terminology for body parts. It is okay. There's nothing to be embarrassed about. Don't give them, different names which they will, dismiss anyway. And if there are any problems, concerns, seek help, professional help much earlier rather than avoiding it. So these are kind of the most important takeaways. And I hope that this series is useful in letting parents develop some confidence and open up for a conversation. I know we cannot provide all the answers in this video chats, but I think this is good that we started talking about it. Thank you for your time.
Exactly, exactly. Because when we started talking, also we ourselves were confused as to how to go about it. But as you start talking, things become easier. There is exchange of ideas. So parents
Absolutely.
and kids, I think, know that ask, as you say. So acknowledge what your child is telling. That is so important,
Yeah.
and be sensitive. Don't immediately react to what the child is telling. And case for keep a secret with the child. I mean, don't go about telling the whole world that your child is, talking about all these things. So maintain that confidentiality with your child, and definitely
Yeah.
when you respect your child, you get that back. Thank you so much. Thanks a lot.
Thank you.